It's the world's leading cause of death, the #1 killer. It's heart disease. It's killing more than 20 million every year. But now researchers say that one dose of a new experimental therapy can cut bad cholesterol by up to 62% due to how it alters the DNA in your liver. Interventional cardiologist Dr. Craig Basman joins us now. Dr. Basman joins us now to break it all down. Dr. Basman, thanks for coming in. This is amazing. This would be a miracle drug.
This is a game changer for the field of cardiology.
So tell us about the drug. How is it being used and where are we in the testing?
So, right now it's phase 1, which is really early on, but very promising data. So we're optimistic, but we're cautiously optimistic. And what we're talking about is instead of fighting things downstream, we're going upstream. We're actually modifying DNA. And there's some DNAs that's responsible for toxins in the body, including bad cholesterol. So we're targeting a DNA PCSK9. And basically by doing that, we're lowering your bad cholesterol, that LDL that everyone speaks about you don't want.
Right.
And by doing that, if you can lower your LDL, we know that that's associated with a reduction in cardiovascular events in the long term.
Is that the #1 reason that people get heart disease or have a heart attack because of bad cholesterol?
Well, it's a silent killer. So heart disease, there's many factors. And cholesterol is one of those things that nobody knows about. So you don't know unless you check. And cholesterol has to be managed. And what we've known is that the lower your LDL is, the most reduction you're going to have in heart disease over the long run is.
Right. So now if you have high cholesterol, you can take a pill to try to lower that. In the back of your mind, you're fearful of what that could produce. It could produce a heart attack later on down the road. But this would be a one injection or a one-time pill that would lower your cholesterol forever?
Well, it's very, as a cardiologist, it is really hard to get people to take their cholesterol pills, right? There's compliance issues, there's medication interactions, there's side effects. So it's hard to get people to take their cholesterol pills. So now we're talking about a one-time injection, which would modify your DNA and make it so that your regulation of bad cholesterol is much better, and you will start reducing your cholesterol, your LDL. And by doing that, that's going to reduce things like stroke, heart attack, and other cardiovascular events in the long run.
Who is the best candidate for this medicine?
So right now, we're talking about higher risk population. That's who the study's looking at, because we're not going to try a gene modification therapy, which is, again, gene therapy is new. We're talking long-term issues we don't know about. So we're going to start in higher risk people that are at risk for cardiovascular events in the next 5 to 10 years. Okay. We're trying to risk reduce those people. But theoretically, who may benefit the most is, if you think about it, plaque starts to develop in the neck arteries and the heart arteries much earlier than most people think. We're talking about your 20s when this starts. And a lot of it is genes. You can do everything well. You can diet, exercise, and I still see people in the hospital every day that suffer heart attacks because they just have the genes. So theoretically, in the future, and again, this is futuristic, we're not ready for prime time yet, but perhaps the ones that benefit the most is before the damage is done, much earlier on. And I'm certainly not saying don't diet, exercise, and do those other things, but I think the future is extremely bright, and we're very optimistic about these new gene therapies and implementing in cardiovascular disease.
It's very promising. Thank you so much. Great to see you.
Always a pleasure to be here.
Thank you.
Be sure to like and subscribe for all the Fox News latest on YouTube, and catch full shows streaming now on Fox One.